Welcome to the LumiMARK Biopsy Site Marker Ultrasound Guided Deployment video. The LumiMARK portfolio consists of three unique shapes: the tulip, lotus, and rose. These markers, made of nitinol, are under compression inside the cannula and will expand into their unique shape upon deployment. Nitinol markers are bare and without a carrier that would typically decrease the drag of the marker during deployment. And with each shape under compression inside the cannula, there is a counterforce exerting outward from within the cannula. So users may experience additional tactile feedback and a slightly higher force during the deployment stroke than a biopsy marker without shape expansion or sonographic carrier characteristics. During deployment, the 5mm tulip and its petals will expand immediately upon exiting the cannula. Due to the longer lengths and unique shape designs, the 7mm lotus and 10mm rose shapes experience a longer, continued resistance throughout the deployment stroke. During deployment, the user may readjust the position of the needle tip while these markers visually exit the cannula. Before removing the LumiMARK biopsy site marker from the packaging, be sure to review the packaging for any potential damage. Use careful aseptic technique to remove the marker applicator, as it has a sharp beveled edge designed for direct puncture. Take a moment to check that the marker is not exposed outside the sharp tip and there is no damage to the sharp end of the applicator. Insert the LumiMARK applicator into the breast either directly or through a 13-gauge coaxial cannula. Using ultrasound guidance, advance the applicator to the desired depth. Using a forward motion, depress the plunger through the first click to release the plunger and a second click to deploy the marker. Press completely until the plunger bottom contacts the handle to deploy the LumiMARK biopsy site marker into the biopsy cavity. Note the hyperechoic marker as it exits the applicator. Remove the applicator, coaxial cannula if applicable, while holding light compression on the breast. Gradually release compression from the breast. Conduct a post-deployment image for confirmation. Thank you for partnering with us to advance breast care. It is recommended that you read the instructions for use for the LumiMARK biopsy site marker. Using the tissue marker in accordance with Mammotome instructions contributes to safe and successful procedures for you and your patients. If you have questions, please visit mammotome.com and select Contact Us to reach a Mammotome representative.